I know what you're thinking. Another face, another person, another 20 minutes that I have to listen to this dude talk so I can get done with this assignment. And although that is true, and I'm not going to spare you those 20 minutes, I would argue that I have some pertinent information that's going to help us in our career path. As you know, the world is changing, our communities are changing. So that means the faces that we're going to be seeing in the hospital system are going to be different. They're going to come from all different walks of life. According to the public health records from 2014, minorities will be the new majority by 2043, which is just around the corner. That is going to come to fruition while we are practicing our career. And also, according to a survey by the American Journal of Nursing, in 2017, only 19.2% of the nurses in the field were from a minority background, which is a travesty. That is a super underrepresentation in the hospital system. And I believe that having minority representation in healthcare eliminates and limits health disparities. It helps to add a different dimension of care and understanding of the patients that we're going to be seeing. And it also is a great indication of equality across the healthcare setting. Now, I would challenge you to think about this example. You're a Clemson fan. Let's say you're a Clemson fan. You got your orange shirt on with the tiger paw. You got maybe a little bit of purple. You're rocking it all, and you're going to go represent your team. You're going to go to the stadium and you're going to watch them play. Well, let's say you get tickets and they sit you in a seat and you're surrounded by Carolina Gamecocks. All the fans. You don't see any orange around you anywhere. You're going to feel super uncomfortable. You're going to feel out of place, like a fish out of water, right? I can argue and imagine that maybe patients feel the same way whenever they go get a procedure done or need some treatment in the hospital. They already don't want to be there. Nobody wants to be there. You're sick and you need this help. So when you see somebody that looks like you and understands you, they get your spiritual differences and preferences, your traditions, your culture, your gender. That speaks volumes for that. That adds a level of comfort and understanding that means the world when it comes to delivering care and your experiences. So I understand that in all situations, you're not going to be able to have every race or background represented in the hospital system, but the next best thing is cultural competency. We can always learn about an individual. We can always look up information and be aware of what we need to do for our patients because it makes all the difference and it's just the right thing to do. You have to do it. So, in this case study that I found on YouTube, there is a patient, and I'll give a little background on him. He is a male patient. He's 71 years old, and his name is Jean-Pierre. He is being admitted into an outpatient facility for a renal biopsy. And what we know about him so far is that he's African American and that he has no allergies. So as I play this, I'm going to list some of the problems that are occurring with his interactions in the nursing care and give the correct way to handle those situations. So without further ado, here goes the first scene.
Can I help you?
Yes, my father's here for a procedure, Jean-Pierre.
Jean-Pierre, I'll need your ID and insurance card, please.
Ou une carte d'identification avec assurance carte.
Yes, Mr. Jean-Pierre, 71 years old, African-American, here for a renal biopsy, correct?
Yes, but my father's Haitian.
What's the difference? Just have a seat right over there, please.
So as we see here, Jean and his son are entering in for, are checking in and giving their information to the person taking it for them, and she responds when Jean's son says he's not African American, he's Haitian. She says, "What's the difference?" Which is pretty disrespectful, because I don't know if it's obvious for a lot of people, but there's a huge difference between Haitians and Americans. First off, according to PubMed.gov, it is common practice to do voodoo, which means that you could have maybe different remedies that they might partake of or do that can affect what kind of treatment and things that we can be able to do for our patients. So the important thing to do is to correct that information, maybe apologize, and get that in there, because they're going to need that. The nurses are going to need that later anyways. So that way they can be ready for the patient that's coming in. They can make adjustments and educate themselves on maybe spiritual preferences, traditions, anything that this patient might need. That information definitely needs to be passed off, and she needs to be more considerate of what's going on. So let's go ahead and play the next scene.
Let's get this done quickly so I can go on break.
Mr. Pierre, my name is Nancy and we're here to complete the nursing assessment.
Il va demander quelques questions. Yeah, my father doesn't speak English, but I can translate.
Actually, we need an official medical translation.
Sure, you can translate. What's the difference as long as we get out of here faster? Can you ask Poppy if he has any allergies?
Est-ce que vous grippez? No, no. No, he said he has no allergies.
Okay, so as you can see, it looks like we have two nurses. Maybe one is in orientation and learning, and then you have the teaching nurse, the one taking the information, and she already says, "Let's hurry up and get out of here. Like, I need to take my break." And given the situation and what's going on, sometimes you get overloaded and you're just ready to take a break. I mean, that's understandable. But what's not acceptable is the way that she handled the situation. Let's say she goes in here and she's in a rush and she doesn't get the information that she needs that's going to affect this patient's health. Something very important. So she asked the patient what allergies he may have. And instead of getting an interpreter like the other nurse had recommended, she just went ahead and went with the son. So what the son actually said was, "Do you have a cold?" instead of "What are your allergies?" Which could be a huge safety issue when coming to dealing with a patient, because if he doesn't say the right thing or get the right information, then we have the potential of running into a problem later on. So Jean answers no when he should have said what his allergies were, right? So let's say he's allergic to penicillin, or has asthma and is allergic to shellfish. That's a huge contraindication if he was to get some kind of renal examination done that dealt with contrast. We're putting him at a future risk for a complication if that happens, an allergic reaction. So that is a huge legal issue already. We need to be able to provide the right interpreter for the patient accordingly. It ultimately means life and death for him. And according to the American Journal of Nursing, nurses are responsible for over 7,000 of cases of malpractice and from neglect just in 10 years of time. So it's definitely something that we have to handle appropriately, and just take the time, despite how we feel and what's going on, take the time to do it the right way. So let's play the next scene.
Mais pour qui ça, je donne la siffler sur mes conscients, hein? Je mal fait ça. Dites ça pour nous.
Ça va pas mieux que ça.
Excuse me, sir.
Yeah. Can you stop whistling? In Haiti, it's disrespectful to whistle in front of elders.
My mistake.
So we see in that scene, John is getting actually transported by the assistant to the operating room. And as the assistant is moving him, he is whistling. And, you know, John, being Haitian, where elders are held in high regard in the community, it's disrespectful in his culture to be whistling in front of him like that, which he relays to his son, and his son translates to the assistant. And the assistant stops. It's the right thing to do. But the wrong thing was to roll his eyes, especially when the patient's son was looking directly at him, staring him in the face. If you're going to do it while he's not looking, right? That makes sense. But the right thing is not to do it at all. And maybe even to apologize for that, saying, I'm sorry, I wasn't aware. Forgive me for my ignorance. I'll be sure not to do that again. So let's go ahead and play this next scene.
Mr. Pierre, you need to leave your oxygen on. Mr. Pierre,
What's going on?
your father won't keep his mask on.
Pour qui ça which here?
Pas besoin. Je me sentis bien pourquoi mourir. Dis ça, moi.
He said he's fine. My father thinks that oxygen is for people that are really sick. Many Haitians think that.
That may be, but here it's not an option. He needs to wear the oxygen.
So in this scene, we see that Jean is concerned about the oxygen. His view, he views that oxygen is just for sick people. I don't need this. It's for really sick people. Why do I have to have this on? Well, he is obviously in some kind of respiratory distress. So I don't know if you saw that, but on the monitor, it says O2 stat was at 91, and we know we got to keep it above 92%, right? So it's just common sense to have it. You know, a lot of times we think we know better, but when it comes to health, I feel like we have to trust the nurses at most points, you know. So I equate it to my son. I have an 11-year-old son, and he doesn't feel like he should take a bath or shower. If it were up to him, he would never do it because he feels like he doesn't need to. Like, I hate this, right? But you know, Daddy knows best, and you can't go to school stinking because you're gonna get made fun of. And as we know in our profession, it just leads to a doorway of infection and bacteria and a plethora of other issues. So the correct way that nurse should have handled that was to acknowledge the patient's concerns. Not to disregard him, not to be as a matter of fact, but to acknowledge his concerns. Maybe explain to him that once we get his vital signs to a safer level, that we'll remove that oxygen mask as soon as we can. We'll get that off of you, sir, but we got to take care and make sure that everything's okay. And it also concerns me, by this point, they still don't have a translator. There's no translator there for them. They're still using the sun. So that is something that still needs to be handled, and it hasn't yet. Okay, let's play the next scene.
The doctor said your father should be discharged later this evening.
Oh, that's great. Did you goodbye? Okay, look like it, I swear.
Oh, ok. Mais dis pour même grand goût, so capot ton petit bouillon sur la calame, I swear.
My father said if we can bring some stew from home, would that be all right?
Let me check, okay?
Okay, thank you.
Hey, Betty. Mr. Pierre wants to know if he could eat food from home.
Are you kidding? Tell him no.
Why? On his chart, there's no diet restrictions.
Really, Nance? Do you want the entire floor to smell like curry?
Again, with the disrespect, that nurse will not do anything for her patient. anything out of her way. As you can see, the training nurse mentioned that, hey, patient wants to eat a dish, wants to eat some stew. Is it okay? It looks like on his list there's no diet restrictions or anything like that. And she responds with, what? You want the whole floor to smell like curry? One, that's super disrespectful because curry and stew would probably be two different things, right? But two, there's no contraindications to why he can't have that dish. Being in a situation where you're already uncomfortable, you're already in a place you don't want to be, that would add so much comfort for that patient in that moment. Just to have some good food to have for him, right? Super disrespectful and not acknowledging his traditions and what he may want goes against what we're supposed to be doing. So in that situation, if everything checks out, it's okay to let him have that food for that time. So let's move to the next scene.
On his chart, there's no diet restrictions.
Really, Nance? Do you want the entire...
Oh, Papa, so again. Nurse, can you please come help my father? He's still in pain.
Please do something. Nurse, can you please come to the room?
Are you gonna answer him?
This is the 4th time he's complained. I told him he needs to wait for the medication to kick in.
Are you sure? Because he...
Listen, Nance, people of this culture, they're babies when it comes to pain. You just gotta give him more time.
That one, I believe, is pretty obvious. That is a horrible way to handle a situation where a patient is obviously in distress and in pain. And as we know, when a patient says he's in pain, he's in pain. He's right. We have to treat that. No ifs, ands, or buts. We have to handle that situation. So, despite handling it in a disrespectful way, an unprofessional way, they should have gone in there and checked on the patient. They should have done a focused assessment. Does this patient have a fever? What does the incision point look like? What kind of pain? What level of pain? Redness? Is there any swelling? Is there any drainage? Any complications to this invasive procedure probably needs to be notified to the provider. So that way, if it's a medical emergency, he can come check it out and make some further interventions because this guy's life depends on it. We don't want to make a situation any worse than it has to be. So we'll go ahead and move to the next scene.
Papa, okay? So again. Papa, okay, do that? Papa. Papa, levez. Allô, Papa, parlez avec him. Nurse, I think my father passed out. Parlez avec him, levez, Papa. Papa, c'est okay. Parlez avec him. Réponds, Papa. Papa, levez.
Excuse me. Sir? Are you okay?
What's going on? The patient's been completely in pain for the past half hour.
I told him to wait for the medication to kick in.
Didn't you take any vital signs?
There's no response, but there's a pulse.
I'm calling Code Rescue.
Hello?
We have a Code Rescue.
I know y'all were all thinking what that nurse in training was thinking when she gave her that look, like, girl, this is all your fault. But in reality, she has just as much of a right to be able to report that. We're supposed to be advocating for our patients' rights. We're supposed to make sure that they have everything they need in order to have successful come back from health. We want them to be okay the best way that we can. So she should have probably went to the charge nurse or maybe above that to management when she witnessed all this neglect happening, because at the end of the day, her name's going to be signed off on that sheet too. As we see, the act of neglect led to this further complication. She said earlier that she tried. The patient complained up to 4 times about the pain, and he's just a wuss, basically, that he's just a big baby is what she said, which is so inconsiderate and opposite of what we need to do. So let's go ahead and move to this last scene, and we'll go from there.
What's the deal? Can he leave when he wakes up?
Unfortunately, with the change in your father's condition, we'll have to keep him here overnight for observation.
A whole night in this place? Are you serious? I can't believe this.
I'm sorry.
So what we have here is that because of the complications, all probably which could have been avoided up to this point, our patient has to stay in an extra day overnight. Maybe they made it worse. Failing to be able to react in time and advocate for the patient and just be aware of what's going on. And the biggest thing is having a translator there also. Definitely leads to the position that he's in now. And I believe in any situation that we have any patient or anybody coming from a different background than us, that we have to be educated. We have to take the time to go find out about them. Find out about the spiritual choices and preferences, their traditions, their backgrounds, where they come from. It only adds to the level of care that we can give to these patients. And like I said earlier, I know that we're not always going to be able to have the right representation in these hospital systems, but we can always be culturally competent, which goes the extra mile in giving care to our patients. So thank you for putting up with my 20 minutes. And I hope that this case study sticks with you, and we are able, by the end of all this, just to be aware and ready to give our patients the best that we have. All right.